comes from the first two? If you had to say 50% of my diagnosis comes from symptoms and mechanism of injury and 50% comes from the exam finding, or is it 20-80, or is it 80-20? What percent in general?
I would score more towards the mechanism of injury and history, and then exam kind of sports that. So I'm not sure like
what percent? Go ahead. I want you
I would
to
say
guess.
70-30.
70-30?
75-25.
Well, the correct answer is my opinion, which is 85%. Usually with 10 seconds, where does it hurt? And how long has it been hurting for, and what makes it hurt? I'm 95% certain usually that it's a bulging disc, and I can usually tell you which one because I'm cocky and arrogant. But yeah, 85%. So once you do your history, you got what's called a working diagnosis. You know what's wrong. Now you just got to confirm it. And you confirm it using the exam. So when you do an exam, I just made fun. You know what an IME is? Independent medical exam. An independent medical exam is a doctor hired by an insurance company to cut them off from care. So if you have somebody in an auto accident and they come see me and I do a bunch of treatment and the insurance company goes, we're tired of paying for all their treatment. We have 5 doctors in Vancouver and we pay them $1,000 to do a 30-minute exam. They're going to examine the patient. They're going to say, nothing's wrong. And then we don't have to pay anymore. It's going to save us $10,000 in PIP claims. They're called IMEs. Everybody hates them. They're pariahs. See? And they don't, most of them, now sometimes they'll do a thorough history. Most of them don't even do the history. They read through the chart notes. They don't ask the patient any questions. And they have a set exam they do, and they do this thorough exam. And the exam takes 30, 40, 50 minutes. And they test everything. And it's a terror, and I like those when they do that, because then we go to court and I'm like, they were testing all kinds of crap that had nothing to do. They were testing clonus, and they were testing for all these conditions that aren't even related. You're not supposed to do that as a doctor. The idea isn't to do the most thorough exam, it's to do a specific exam. Literally, they do stuff like this. You come in and you go, my shoulder hurts, it's killing me. And then they examine your hip. That's literally what they do.
How is that legal?
Well, because the first thing they say when you do an IME, you know what the first thing they say is, this is not a doctor-patient relationship. I will not be held responsible for any of the opinions I give. That's what they say. When you say this is not a doctor-patient relationship, they're basically waiving, and they'll say it out loud. They'll make you sign a piece of paper that says it, and that's the first thing they say in their report. I don't want to be held responsible for my opinion. See? But what they do is they do a very thorough exam because they're trying to show that I'm thorough, I'm careful. I don't want you to do that. Your exam should be 3 things. What's the first thing you do if you think they have a ligament? What's the most important test you're going to do?
I'm just like, check for ligaments.
Stretch the ligament. What does the ligament do? It stretches. So if you can't stretch, does that make sense? Oh, I gotta leave here in 5 minutes. So your exam should be range of motion, right? And there's 2 ranges of motion, active and passive. If active is positive, you can't do passive. If they say it hurts, I can't do it. Let me stretch it. Oh, no, can't do it. Don't cause pain. But active. If you can actively do it, then you kind of put a little pressure on it. You do, and that will pin it down really fast. It's super sensitive, super accurate. So make sure you understand every joint, and you have to know when I stretch it this way, which tendon am I stretching, right? Which ligament am I stretching? So make sure you help her. We want to be at 10 out of 10 in understanding the anatomy. How do you stretch each ligament in the shoulder? And I want you guys to review that together really quick. Pull out an anatomy book and say, which test? And then they'll have an orthopedic test. So you're going to do range of motion, active and passive. You want to test the muscles. Those are easy to test because you want to rule them out. Muscles are generally not the problem, but they could be. They're symptoms, not the cause. And when I say muscles, that would be tendons. So you gotta do range of motion for the ligaments, check the muscles, check the tendons, and then do at least, I prefer, 2 orthopedic tests. That's it. By the time you're done with this, you've really narrowed it down. I know that they have a torn ligament. I think it's the infraspinatus. I'm going to test the infraspinatus and the muscle and the other. I'll have it narrowed down. Then I'm going to narrow it down more. Then I'm going to do 2 orthopedic tests to confirm it, right? And I might do 2 more to rule out something else, because the big problem is we'll have a compound injury. We'll have 3 or 4 or 5 different conditions. Make sense? Any questions about this? So I'm going to take off. You guys are going to do your thing.